This is Whitburn Surgery, an EMIS practice with around 5,500 patients and 4 GPs. It's located on the beautiful coastline of South Tyneside, and I've heard they're doing a great job of working with their local pharmacies, so I'm really excited to find out why and how.
So the patient contacts the surgery, or it could be via e-consult. However, the patient puts in a request for an appointment, so to speak. All our staff in reception and admin are trained as care navigator and signposters. So they will then identify if they're suitable for the pharmacy scheme. They'll then offer it to the patient, explaining the process to them, and then they'll put the referral through. So it never really meets a GP or a nurse practitioner. It's pulled out before that.
I think it's really good. Our patients really took to it. I think it's the way you sort of sell it to the patient. So it is about that, they're helping them, they're getting them seen quickly, efficiently. They can prescribe if it's certain things, and that's a lot of people are just like, I want this, and they think they know what they want, and when you talk about it to them, they're quite happy to give it a go, especially working people, because they can just go after work or pop in on dinner time.
I went down and introduced myself as the new manager, met the lead pharmacist, also the owner, and discussed that we would be starting to use this and were they okay with that, and they were great, really happy to do that. And then we regularly have sort of catch-ups to see how things are going.
A lot of people phone up for a cough and cold and they want to see a doctor because they've had a cold. Have you been to the pharmacist? No. Well, are you aware that the pharmacist can advise you? And I think it's about telling them that they need to speak to the pharmacist. They think they're going to speak to counter people and they're not happy to do that, but if they know it's a pharmacist, it's a big difference.
So we have signposts and guides we've got our own for the practice that I've kind of created that because we signpost out to a lot of services, but within there is the national guidance for referring to the pharmacy, lets them know any age ranges, if there's any exclusions. So once they deem it suitable from the form, then they'll refer through. The patients have been great about the service, they embrace it quite well. Obviously we do get things back from the pharmacy, that happens, that's totally okay. They get in touch with us and they're quite good. You normally hear back within a couple of hours, which then allows us to still then treat the patient the same day.
GPs and the nurse practitioner took to it really well, because I think there was things that they were saying which were like, it's pointless me doing this, somebody else can do it, and if it takes the workload from them, it's fantastic.
I think it's you do need to put the trust into your staff. I think in South Tyneside, all of our practices are well trained in signposting. It's not clinical triage, and I think that's important. And we make that very clear to our patients. There's no clinical, and we are always safety netted that if the patient isn't happy with that option, they can come back to us.
They can call, they send through a document. Sometimes we do get a call that a patient needs to be seen fairly soon or urgent. We'll see obviously if we've got an appointment and try and get them in with the GP. A lot of the times it can just be they've given them advice but referred them if within this certain time scale it doesn't rectify, see your GP.
I've really enjoyed my visit to Whitburn Surgery, and from my perspective it seems as though they've got a really slick system in place and they seem to be getting significant benefits from Pharmacy First as a result. But what do you think? Let me know by contacting me at andre.yeung@nhs.net. I'm really keen to hear from you, and if you've got any comments or questions about anything you've seen in this video, or if you want any pointers about how you can make this work in your practice or PCN, please do get in touch. Thanks for watching and see you again soon.